Everyone, and welcome back to the Osteo and Physio YouTube channel. Today we're going to be looking at why am I getting pain around the front of my kneecap. There are many different musculoskeletal conditions that can refer pain around the kneecap. So number one of the most common types of triggers or most common conditions that we see is something called patellar femoral pain syndrome. So when we think of syndrome, it's a combination of different signs and symptoms that causes pain and pressure to form around the kneecap. This can either be due to previous trauma or laxity around the patella and the femoral joint as they come together, so where your kneecap sits within the knee. So if you're someone who's quite hypermobile or you've had previous fracture or trauma into that area, it can cause the kneecap to not sit properly within the joint. This means that as you're doing stuff, for example walking or running or moving, it can cause abnormal loading to form around this joint. This can either predispose pain underneath the kneecap itself. If it's someone that's had this for a long time, we might find bony fragments or spurs forming up underneath the kneecap, or it might mean that you put pressure through certain areas and therefore feeling pain potentially on the inner part of the kneecap or all the way around. What people normally present with is something called circle signs. So we've got the kneecap here, they're kind of doing this around the kneecap. So they find that when they sit for long periods of time, they feel a dull ache, they feel pressure and they feel soreness around that kneecap area. They sometimes find if they're sitting in a low chair, which is causing the knee to be more in a flexed position, so we call this Thieter's sign. So you think if you're sat in the cinema for long periods of time, this can cause pain and pressure to form around the kneecap. It can also be triggered on any kind of movement that puts more pressure over that joint. So in particular going downhill, they report a lot of pain and pressure over the knee as it's having to stabilise that movement. And what we normally find is, yes, localised pressure around the kneecap, but we normally find it manifesting up into the front of the thigh over the quadriceps muscle. So we find we get a combination of the two. What we would want to test for when someone comes into clinic is how is that kneecap moving? So as they're bending and straightening the knee, is it deviating the kneecap into an abnormal position? If we resist and test the quadriceps, does that cause more pressure around the kneecap? And what we would also want to palpate for is any swelling or inflammation of the bursa, which are fluid-filled sacs around the kneecap that may have inflamed in conjunction with this injury. Number two, we can get a patellar tendinopathy or infra patellar tendinopathy. So it's where your quadriceps muscles come down and they actually attach below the kneecap. So what we find is it's quite pinpoint pain. So if the kneecap is here, it's quite pinpoint pain just below the kneecap, and it's normally over that area. They can also present with local sharpness and pressure forming down through here. They might do something like a banana sign, call it a banana sign, where they're doing this underneath the kneecap, where because of the damage and inflammation of that tendon, we've inflamed the infrapatellar fat pad, which is incredibly sharp, tender and sore. Normally or typically we aggravate or cause pain over the infrapatellar tendon when we are recruiting the quadriceps muscles. So the main muscles are over the front of the thigh. There are 4 different muscles, but they attach one above the hip with the rectus femoris, 3 on your femur, which is the bone at the top, but all blend together into this tendon. What we would find on testing and movement and what they may report in their history is every time they straighten the leg, so they open and straighten the leg, which fires through the quadriceps, or extreme flexion, so bending the leg, it can pull and cause soreness over this tendon. So any high impact sports, for example any kind of jumping, HIIT training for example, or basketball or netball, can cause soreness to form around this area. Initially when someone presents, it is inflammation and sharpness over this area. If they repeat damage or abnormal loading into that tendon, they can start to get something which is micro trauma, so it starts to wear down the tendon over time, and this is where people can present with quite chronic history of pain around that area, so that every time they fire through the knee it triggers pain just below the kneecap. What we would want to look at is starting promoting blood flow and movement into that area, so starting to relax around the quadriceps, take the pressure off the tendon, but also look at the alignment between the hip, knee and the ankle to make sure they're not putting excessive pressure underneath the kneecap. Number 3, osteoarthritis of the knee joint can also refer pain around the front of the knee. So although it's more commonly seen on the inner part of the knee, on the medial joint line when we get wear and tear, due to the abnormal loading between the femur and the tibia, so the two parts that form the knee joint, we can also get referral around the front, because you think if someone's progressing with wear and tear, which is forming stiffness, restriction and limitation of movement, of course there's going to be this chain reaction where you adapt your gait or your moving mechanics. So what can happen is if you're shifting to avoid pressure on the inner part of the knee, you are more likely to cause pain and pressure on the outer side of the knee, which may pull onto the patella, so onto the kneecap, into a slightly abnormal position. So for example, if you're firing through your vastus lateralis, which is your outer quadricep muscle, which blends down just below the kneecap, because of the pain and stiffness on the inside of the knee, it's going to pull it and load it in a slightly abnormal pattern of movement. And this is where, when anyone comes in, we get very random patterns of pain and symptoms. So even though they've been diagnosed with a condition, we want to look to see how the body has compensated. Has it started to adapt due to this chronic pattern of pain? And therefore, is this why we're suddenly getting pain around the front of the knee? So you'd want to know, okay, if someone's coming in with osteoarthritis, what is the degree of damage? Have they had an x-ray to the knee? Are they having any other interventions? If it's just being managed through rehab, we can see if we can help to soften and get the knee moving, as well as looking above and below into the hip and the ankle joint.